What if I told you that 5 of the most common medical tests recommended to people over 65 aren't just unnecessary, but could actually be a trap? Now, I know what you're thinking. We're all raised to believe that more testing means better health, that every scan is a step toward a longer, healthier life. But after 2 decades as a physician, I've seen firsthand how these routine checkups can trigger a domino effect, a cascade of care that leads to risky procedures, overwhelming anxiety, and life-altering complications, all based on findings that would have never caused a single problem. This isn't about avoiding your doctor. It's about becoming a smarter patient. It's about protecting your quality of life, not just chasing a number on a lab report. Today, I'm sharing the 5 tests I would strongly advise my own family to question after 65. This is the conversation your doctor just might not have time for. And the first one, it's one of the most tempting offers in modern medicine. Test number 1, whole-body CT or MRI scans. It sounds like the ultimate health hack, right? A single scan that looks at everything, from head to toe, promising to catch any disease before it even starts. Companies market these directly to you, playing on our deepest fears. Who wouldn't want that peace of mind? But here's the insider secret. These scans are a perfect example of how more information does not equal better health. The biggest danger of a whole-body scan when you're otherwise healthy is something we call incidentalomas. These are tiny, harmless abnormalities, a little cyst on your kidney, a benign nodule on your liver. In fact, studies show these incidental findings pop up in a staggering 86 to 97% of healthy adults who get these scans. And here's the trap. Once a radiologist sees something, they have to report it. They just can't ignore it. That's where the cascade begins. That harmless spot triggers a recommendation for more tests. Then, maybe a biopsy, which is an invasive procedure with its own risks of bleeding and infection. All of this creates huge anxiety, often for weeks or months, only to find out that the initial spot was nothing. For people without symptoms, these scans have shown no survival benefit. They don't make people live longer, but they do crank up the rate of unnecessary procedures and the stress that comes with them. So what is the alternative? It's simple and proven: targeted imaging. If you have specific symptoms, unexplained weight loss, a pain that won't go away, then a CT or MRI of that specific area is an incredible tool. But using it as a fishing expedition in a healthy person is far more likely to cause harm than good. So if you don't have symptoms, it's best to steer clear of the just-to-be-safe full-body scan. Test number 2, a brain MRI for mild, age-related forgetfulness. We all have those moments. You walk into the kitchen and forget why you're there. A name is right on the tip of your tongue, but you just can't grab it. It's a scary feeling, and our minds immediately jump to the worst-case scenario: dementia or Alzheimer's. The impulse is to demand a brain scan to see what is going on. Here's the thing: if you take a brain MRI of a healthy 70-year-old, it almost never looks perfect. Scans of older adults without any symptoms frequently show what are considered normal changes of aging, like mild brain shrinkage or small changes in the white matter. But when these findings are written down, they're described in alarming terms like cerebral atrophy or white matter hyperintensities. Hearing those words can cause profound anxiety, which, ironically, can make your memory feel even worse. You start to doubt yourself, and the fear of having a bad brain becomes a self-fulfilling prophecy. In most cases of mild, age-related forgetfulness, these scans give us no actionable information. They don't change the treatment plan. They just add a layer of fear. The findings on the image often don't even correlate with how your brain is actually functioning. For mild memory concerns, a much better first step is a series of simple cognitive tests a doctor can do in the office. These tests check your actual function, your ability to recall, reason, and solve problems. They give a much more accurate picture of what's really going on than an image that's just going to show normal, age-related changes that will only make you worry. Test number 3, a routine treadmill stress test without symptoms. The cardiac stress test seems like a pillar of heart health. It's often ordered before a surgery or as a routine checkup. The logic feels sound. Let us push the heart a bit and see how it holds up. But what if I told you that for an older adult with no cardiac symptoms, this test is famous for getting it wrong? In asymptomatic people over 65, these treadmill tests have a very high rate of false positives. That means the test suggests a serious blockage when, in reality, there isn't one. It can be due to age-related changes, medications you're on, or other things that have nothing to do with a dangerous artery. But once that test comes back abnormal, you're officially on the medical conveyor belt. The next step is almost always a cardiac catheterization, where a tube is threaded through an artery into your heart. This is an invasive procedure with real risks of bleeding, infection, and other complications. And what do they find? Often, exactly what you'd expect in a 70-year-old heart. Some plaque, but nothing that was about to cause a heart attack. Yet in the process, you've been subjected to an invasive procedure and labeled a heart patient, which can create a deep-seated fear that actually damages your quality of life. The test meant to protect you ends up stealing your confidence. The best stress test is your daily life. Can you walk up a flight of stairs, carry your groceries, take a brisk walk without chest pain, or being incredibly short of breath? If so, you're passing a real-world stress test every single day. For those who want to be proactive, a coronary artery calcium score, a low-radiation CT scan that actually measures plaque, can be a much better predictor of future events without the high false positive rate of a treadmill test. Before we dive into number 4, a test millions of people get every year, I'd love to hear from you. Have you or someone you love been pushed towards one of these tests? Tell me about your experience in the comments. Your story might be exactly what someone else needs to hear. Test number 4. A colonoscopy after age 75 for average-risk individuals. Let me be crystal clear. The colonoscopy is a life-saving tool. It is absolutely crucial for adults to get screened according to guidelines, which now start at age 45 for most people. But every medical test is a balance of benefits versus risks, and that balance changes dramatically as we get older. The main benefit of a colonoscopy is finding and removing polyps that might, over 10 or more years, turn into cancer. For a 50-year-old, that 10-year window is critical. But for an 80-year-old who has had clean screenings in the past and has no symptoms, the math just isn't the same. As we get older, the risks of the procedure itself go up. The prep drink can cause serious dehydration and weakness, increasing the risk of a fall. The wall of the colon also gets thinner with age, which raises the risk of a perforation, a tear in the colon that can be a life-threatening emergency. When you weigh the rising risks of the procedure against the shrinking benefit of preventing a cancer that might take a decade to become a threat, it becomes clear. Continuing routine screening for many older adults just doesn't make sense. That's why major groups like the U.S. Preventive Services Task Force recommend stopping routine colonoscopies at age 75 for average-risk folks and having a careful, individual conversation about it from age 76 to 85. If you have a history of clean colonoscopies, the best approach after 75 is to be aware of your body. If you develop new symptoms like blood in the stool, a lasting change in your bowel habits, or unexplained weight loss, then a diagnostic colonoscopy is absolutely the right call. For continued screening in some situations, much safer stool-based tests are often a better alternative. Test number 5, a routine PSA test for prostate cancer after 70. The PSA blood test is easily one of the most debated screenings in medicine. It's a simple blood draw to screen for prostate cancer. The idea of catching it early is powerful, but the reality is way more complicated, especially for men over 70. The PSA test is infamous for not being very specific. An elevated PSA can be caused by many things that aren't a dangerous cancer, like a benign enlargement of the prostate, which is incredibly common, inflammation, or even a recent bike ride. This leads to a ton of false alarms. An elevated PSA almost always triggers a prostate biopsy, which means taking multiple needle samples from the prostate. This procedure has risks of pain, bleeding, and serious infection. Worse, many prostate cancers found in older men are so slow-growing they would never have caused a problem or shortened their life. This is called overdiagnosis, finding a cancer that was never a threat. Treating these harmless cancers with surgery or radiation can lead to devastating, lifelong side effects like incontinence and erectile dysfunction, tanking a man's quality of life without actually extending it. For these exact reasons, the U.S. Preventive Services Task Force explicitly recommends against routine PSA screening for men aged 70 and older. After 70, the conversation should shift from routine testing to shared decision-making. It needs to be a real talk with your doctor about your overall health, your life expectancy, and what you value most. The key question becomes, even if we found a slow-growing cancer, would treating it actually improve your life? For many men, The answer is a clear no. Empowerment segment: how to talk to your doctor. So what do you do with all this? The goal is not to go into your doctor's office and refuse everything. The goal is to start a real conversation, to become an active partner in your own care. Here are 4 powerful questions to ask your doctor before you agree to any test, especially after 65. 1. What are we looking for, and what will we do differently if we find it? This cuts right to the chase. If a positive result, 1T actually changed the plan, why do the test? 2. What are the risks of a test itself, including the chance of a false alarm? This helps you see the first domino before it falls. 3. If the test is positive, what are the harms of the follow-up tests and treatments? This forces you to look at the entire potential chain of events, not just the single test. 4. How will this test help me live a better life, not just a longer one? This is the ultimate question. It shifts the focus from just finding disease to preserving your function, your independence, and your joy. You see the pattern here, don't you? It's all about that cascade. One ambiguous test leads to another, more invasive test, which leads to a procedure and potential complications. And somewhere along that path, we forget to ask the most important question: is this person actually better off? After all my years in medicine, I've learned that true health, especially as we age, isn't about perfect lab results. Health is about function. It's about having the energy to play with your grandkids, the ability to travel, the clarity to enjoy your days, and the independence to live life on your own terms. The path to a healthy life after 65 isn't paved with more tests. It's paved with more wisdom. It's about knowing when to say yes, and just as importantly, knowing how to ask the right questions. If you found this helpful, please subscribe and click the bell for more insights on how to navigate your health with confidence. And do me a favor, share this video with a friend or a family member over 65. It could be the most important checkup they get all year.